Hey guys, Sabrina here with Las Vegas Cosmetic Recovery, wanting to talk to you about key number 2, massage, and the types of massage that you should be looking out for after you have your plastic surgery. So I do help and facilitate patients preoperatively and postoperatively with their recovery and massages. So the biggest thing is that you are going to want to look out for licensure. I am a board certified massage therapist here in Las Vegas, Nevada. I am licensed through the state of Nevada and I took the NBLEX. That means that is why I am board certified, because I took the state test. I don't just have a certification, I have a license. That being said, nurses, OTs, PTs are allowed to do massages as well. So if a nurse is going to facilitate you and she claims or he claims to be a nurse, make sure that you're checking their license or certification or credentials. You always want to make sure that you're checking people's credentials, because that tells you if they are who they really are and if they really are able to help you. Now, number 2, just because you're a massage therapist or a PT and OT, whatever, doesn't mean you know plastic surgery. Now, number 2, when you're looking for a good provider, you want to make sure that they have certifications and knowledge that they actually went and learned from someone who knows what they're doing. For example, I am double certified in lymphatic drainage. I am certified in myofascial release. I am actually a certified cosmetic surgery therapist through the Norton School of Lymphatics. And I took a lymphatic taping course that is based out of Brazil. And then also I am a certified breast massage therapist. And I actually got CE credits for it. I got 18 credits for my breast massage certification. And my teacher, who has been a massage therapist for 40 years and had 15 reconstructive breast surgeries, was the one who taught me how to work with breasts. So you're looking for things like that. I have a lot of credentials to back up who I am. But of course, when you're not living in Las Vegas and you're looking for people to help you wherever you are, whoever's watching this, I'm making these videos to help with guidance in what to do after you had surgery. However, if you can find someone preoperatively, create a game plan, and then get that ball rolling, that will equally help you a lot too. So then you can kind of get to know one-on-one who is your cosmetic surgery provider, and if they really know what they're doing. So I definitely recommend pre-op. Pre-op is not available for all of us. And a lot of us don't even know that this is what we're supposed to be doing. So at the end of the day, make sure you check their credentials. Make sure you check their certifications. Now, different types of massage. So I personally feel this might be like what do they call it? Like a trigger topic, whatever, is that you can't only do lymphatic drainage if you are going to be working on plastic surgery patients. You can't just go to a person that only knows lymphatic drainage and think that you're going to have the results that you see on my website. If you go to my website, then you can see a bunch of different of my before and afters of my patients and their results. You won't achieve that if you're only doing lymphatic drainage, because what if scar tissue starts forming? What if fibrosis, which is scar tissue, starts to happen? What if someone gets a seroma? What if someone's incision opens up? And of course, I'm a massage therapist. I do not touch the incision. All I do is just make sure that it's closing good. I have somewhat of a regular background, just like from what I've read about wound care, but I don't do wound care. I'm a massage therapist. I can just advise. So if I see anything, boom, go to wound care clinic. You know what I mean? If there's an opening, if it looks infected, I tell you, go to the doctor. Go to the doctor's got to help you. Or go to a wound care clinic that can facilitate you. Now, that is why lymphatic drainage is the base layer to this beautiful cake of optimizing people's results. But you shouldn't just go to someone who only does lymphatic drainage. Because what if you get fibrosis? Like, you gotta know scar tissue. Which leads me into like all of my certifications and the reason why I chose all these. Because one, the cosmetic surgery certification course was good, but you can't just like my biggest thing also is, and this might even be for my massage therapists who are watching this, you can't domino massage this, guys. Like, come on. Just because I have one patient who is healing fabulous and another patient who's not healing fabulous, I have to do 2 different types of treatments on both of them. I do not do the same massage on all my people. I don't care if both people had lipo. I don't care if both people had tummy tucks. I literally cannot do the same on both of those people because they're both healing differently. Here's a great example. I have 2 sisters. One sister is a unicorn, and those are my people that literally don't do massages. They don't wear compression. They come out of surgery off the gate and they're great, right? And the other sister, and they both have 2 different body types. And the other sister, they both went to 2 different surgeons too. Her surgeon, I actually work with directly, and he told her to come to me. So, the other sister went to Arizona, and she had a mini tuck, and the other one had a tummy tuck, and the other one healed great. But then the sister that the surgeon recommended me, she ended up getting some openings on her tummy tuck. She ended up getting some fibrosis, and she ended up getting a little infection. Now, she's like, I was prepared for the journey, but after seeing how my sister did, I didn't think that it was this, like, much. And this is when I love to say what I tell all my people. You had major surgery. Like, you guys had major surgery. This is a major surgery. You went under anesthesia. They cut off skin. They took fat out. Like, you have to treat it like a major surgery. This sister, she also had her hip replaced. And I think she had a hysterectomy, but she had a few other surgeries. She was like, hands down, the tummy tuck was the hardest surgery for her to heal from. And I do like to say that tummy tucks are generally like easier than lipo, but she saw me like 3 weeks. Yeah, she saw me 3 weeks post-op. And when we start day 1, like you look incredible. Like everybody heals super fast when we start day 1. But that wasn't her case, and it's okay. It's okay. Because now she's healing good, and we're on the right track, and the hole's closed, the infection's gone, and we're exactly where we need to be. But that's why you can't compare yourself. And in this massage portion that we're talking about, that's why you can't do a domino massage on everyone. Nobody's the same. Everybody heals differently, and that is why when you're looking for someone, you gotta make sure that you have someone that is gonna be there for you and is gonna know exactly how to handle situations that can randomly come up, like a hole in the tummy tuck, or fibrosis from the BBL, or a lumpy booty too, which, oh my God, that is probably like the worst. That's the worst, especially because you put fat in your booty because you want this voluptuous booty. You expect an incredible booty, but thankfully there's some techniques that we can do to help kind of get it back into its shape. Of course, sometimes we can't, because when they inject the fat, and everybody heals differently, guys. Everybody heals differently. So big number 1 thing, anything you take from this when you're doing your research, find a massage person that has good credentials, whether it's a massage therapist, a nurse, an OT, and a PT, because you got to make sure that that they're licensed and that they're certified and that they've worked with many different bodies. and that they know how to handle the lymphatic system, the fascial system, scar tissue therapy, and different myofascial techniques. Honestly, that's what you want, guys. So if you took anything from this, take that. Like, share, subscribe, hit the push notifications for all things Las Vegas cosmetic recovery. Bye.